friends, today we are going to present you the clinical curve in ruminant on topic of Trypanosome the silent killer. Our members are ขวัญกล้า ทิปภา พัฒนากร มุทิตา สุพิชชา and me กมลชนก The history on 23rd July 2018 at 3 years old, Thai Brahman heifer cattle weighed around 300 kilograms appeared with depression, hypersalivation, lateral recumbency, and episodic generalized muscle stiffness. The owner suspected that the cattle had been bitten by a venomous snake. Physical examination showed normal temperature, pale mucous membrane, 5% dehydration, decreased heart and lung sound, prolonged rumen contraction sound, and not found snake bite wound. The veterinarian had collected blood from coccygeal artery, and the laboratory results showed Trypanosome brucei evansi from the basmia. Next, we're gonna review about Trypanosome. Trypanosomiasis is a flagellated protozoan parasite in genus Trypanosoma. The parasites live in the blood, lymph, and various tissues that can cause infection of both human and animals. Trypanosome have many species. The cattle has important trypanosome. There are Trypanosoma congolense, Trypanosoma vivax, Trypanosoma brucei, Trypanosoma brucei evansi, and Trypanosoma thylaei. But in Thailand can found only Trypanosoma brucei evansi and Trypanosoma thylaei. All trypanosomes have arthropod vectors in transmission cyclical and mechanical. In cyclical transmission, the arthropod is a necessary intermediate host in which the trypanosome multiply in the digestive tract and proboscis. Undergoing a series of morphological and transformation, the infection is transmitted when feeding called salid variant passed by zesify. The main species being Trypanosoma congolense, Trypanosoma vivax, and Trypanosoma brucei. The zesifly can cause animal trypanosomiasis in Africa, but not found in Thailand. Trypanosoma vivax and Trypanosoma brucei evansi are transmitted mechanically by biting flies, included tamanat. Common name is a horsefly, Stomoxis or stable fly, Hematopota or clake, and Hippobosca or lousefly. The protozoan didn't multiply or morphological transformation in insects. The life cycle of tabanas takes a minimum for 4 months in the rainy season. After mating, females feed on blood and develop eggs. They lay batches of eggs on the underside of leaves. The egg hatch in 2 weeks to larva and develop to the pupa in 3 months, and after that become to adult for 3 weeks later. Pathogenesis are 3 stages. In this disease process, there are pyrexial, anemic, and nervous state. First is the pyrexial state during the intermittent fever occur and followed by the anemic stage. The end stage is the nervous stage during which the trypanosome enter to the brain. Incubation period is 8 to 20 days. The clinical sign in the cattle is chronic or asymptomatic, such as weakness, emaciation, anemia, and production losses. Diagnostic methods for trypanosome detection are performing clinical examination and collecting the blood from the peripheral vessel to perform thin pap smear and wound technique to find the blood parasites. PCR has been developed and became widely used for the detection of trypanosome that has high sensitivity and specificity for detection. And this technique can be identify the subgenus, species, and subspecies.
For the investigation, we went to the Animal Breeding Extension Division in Kanchanaburi Province on the 7th of August 2018. There were 140 cattle in this suspected herd. For inspection, The herd had the average body condition score 2.5 out of 5. During the field investigation, we had found many insects and external parasites, which later identified as Rhipicephalus microplus and Tabanas rufus-cutellatus. We had collected 40 blood samples from coccygeal artery and vein and jugular vein by convenient sampling method and separately filled the blood into EDTA and plain tube. These pictures show blood sample collection procedure. For the laboratory test, the scientists perform complete blood count, ruse technique, and thin blood smear as routine investigation for blood parasite. Complete blood count results show that most of the cattle have normal value of white blood cell count and hematocrit level. From thin blood smear, the scientists found only one trypanosome in only one cattle, and it was Trypanosoma tyleri. Trypanosomiasis can be treated with many medicines. For cattle, there are two commonly used drugs, which are diminacine aceturate and isometamidine. Diminacine aceturate or Gr1 is a curative drug using in infected animals by inject a single dose of 3.5 to 7 milligram per kilogram via intramuscular route. Gr1 is rapidly absorbed and excreted from the body. The onset of action is often recognizable half an hour following injection and reaches the maximum blood levels within 3 to 5 hours. Isometamidine or samarin can be used as both prophylactic and therapeutic drugs given via intramuscular or intravenous route. For the prevention and disease control, first, inspect and treat the herd at regular intervals and conduct the block treatment of all animals in a herd that cannot be maintained by individual application before the onset of rainy season. The prophylaxis program shouldn't be carried out with curative drugs because of the high risk of drug resistance developing during the period that the drug reaches a subcurative level. Next, the vector control. Apply insecticides on domestic animals by spraying, dipping, or pour on to reduce vector. Break the vector life cycle, set fire and use trap to get rid of insects, and cover the pen with mosquitoes net, especially during the rainy season. And in order to prevent the spread of infection, first, suspend animal transportation until the disease outbreak is under control. And after that, conduct pre- and post-arrival quarantine program. And lastly, for vaccination, there are no vaccines available nor likely in the near future because of the ability of trypanosomes to rapidly change their surface glycoprotein to avoid immune response. Thank you for your attention.